A step-by-step process for effective SNF billing. Skilled Nursing Facility, SNF, billing involves the reimbursement process for patient care in skilled nursing settings, including Medicare and Medicaid claims. Step 1. Understand the basics. Familiarize yourself with SNF billing fundamentals, including payment systems, regulations, and reimbursement rates for various payers. Knowledge is key. Step 2. Accurate patient admission. Ensure all patient admission documents are complete and accurate. Collect vital information, including demographics, medical history, and insurance details. Step 3. Conduct initial assessments. Perform comprehensive initial assessments, including the minimum data set, MDS, to determine care needs and establish eligibility for reimbursement. Step 4. Accurate coding. Use correct ICD-10 and CPT/HCPCS codes for diagnoses and services. Miscoding can lead to claim denials, impacting your revenue. Step 5. Verify insurance coverage. Before submitting claims, confirm the patient's insurance coverage and benefits to avoid unexpected costs and ensure timely payments. Step 6. Submit claims timely. Submit claims promptly after services are rendered. Ensure accuracy and compliance with payer requirements for smoother reimbursements. Outsource your SNF billing to InfoHub Consultancy Services. We ensure accurate coding and minimize claim denials, allowing you to focus on delivering exceptional patient care. Contact us today. Thank you.